Experts are tracking 5 more new drugs linked to overdose deaths across East Tennessee. We've been following the synthetic opioid known as cyclorafine, which experts link to almost 60 deaths. Reporter Lauren Levitt talked with the director of the Regional Forensic Center, who says it's uncommon to see so many new drugs at the same time.
Shay, each year the center sees 1 to 2 new drugs show up in toxicology reports. But this is the first time in years that 5 or 6 are showing up around the same time. Each is tied to at least 5 deaths since December. Deaths linked to a new synthetic opioid keep rising. Authorities reported 16 in February to more than 40 in April, then nearly 60 this month.
It is definitely by far the fastest growing synthetic opioid or any analyte that we found in a fatal toxicology that came in since fentanyl in 2017. No other drug has came in and been involved in this many fatal cases in less than a year.
The Knox County Regional Forensic Center Director Chris Thomas is tracking those numbers. He says there have been no reportable cases in May, but they're still waiting on about 30 more reports. The last deadly case was from April 28.
What has become interesting is we're starting to go back and find older cases now that are containing cyclorafine.
As those numbers are rising, Thomas is also monitoring other new drugs closely.
I'm not going to say we've shifted, but we're starting to see now more of the synthetic kratom alkaloids, this 7-OH metragenine and this metragenine pseudoindoxyl, which are these really potent alkaloids that are being mixed with synthetics into the kratom streams.
Those 2 drugs plus 3 others are joining cyclorafine on the watch list. In total, all 6 drugs have collectively been tied to 121 deaths.
We want to make sure that the data and the numbers are heard to as many groups as possible so that people are aware.
Thomas says while his office is spreading the word, they're also working with law enforcement and organizations like the Metro Drug Coalition to help save lives. The director says in cases of emergency, people should start with Narcan as a temporary measure before taking someone to an emergency room. He says though that reversal method could be less effective in some cases, it's the safest route unless you know 100% what drug someone's taken. Shay.
All right. Thank you, Lauren.